This is my papa. He may appear to be a normal man, but what you don't know is that he was actually diagnosed 8 years ago with a disorder, and that disorder is type 2 diabetes. I'm Kendra G, and this is what I'll be doing my presentation today on. Diabetes mellitus type 2 is a metabolic disorder characterized by hyperglycemia or high blood sugar, which is due to insulin resistance or lack of insulin. The incidence of this in the U.S. it was in 2010 about 1.9 new cases that year, and in 2012 it was around 1.7 million. Based on all the data that they've collected, the average is about 798,000 new cases each year that are diagnosed for type 2 diabetes. The etiology, which are the causes of this, specifically within the body, is a lack of insulin secretion or resistance of insulin by the blood. People can also get diabetes from bad, healthy life choices like eating poorly or not exercising enough. Obesity is actually directly linked to causing type 2 diabetes. For every 20% that you increase your body weight from its normal body weight, you double your chance of getting this disorder. Heredity and other genetic factors can also cause you to get this disorder. Some symptoms that people can notice when they have type 2 diabetes are increased thirst and hunger, dry mouth, frequent urination, fatigue, blurred vision, headaches, slow healing cuts and sores, itching of the skin around the groin and vaginal area, frequent yeast infections, dark patches around the skin of the neck, the armpit, and the groin. Also, numbness of the hands and feet can occur. But there's also cases where you don't experience symptoms, which is why it's important when you reach a certain age, as it was once called adult onset diabetes. It's more common in them. It's important to get screened frequently so you make sure that you don't have the disease. Some signs that the doctor can notice when you go in to get checked for the disease are high blood pressure, which is hyperglycemia. I messed up. Okay. Hypertension is actually high blood pressure, but hyperglycemia is high blood sugar, which is also the main thing that doctors notice and the main factor that people have when they have type 2 diabetes. And also high levels of lipids in the blood, which is called dyslipidemia, is what doctors notice when they look for the disease. Some research that's been done on the disease, which is the epidemiology, shows that 285 million people have the disease worldwide. This is most common in developed and developing nations because they have the lifestyles that can cause for less exercise and more eating, which can lead to obesity, which leads to the disease. Women and certain ethnicities such as South Asians, Pacific Islanders, Native Americans, and Latinos have been known to get the disease more. In the past, it's been known as adult onset diabetes, which is what has been more common but recently children have been being diagnosed more with it as the rates of obesity in children have increased, and that's what the main cause of the disease is. In 1985, around 30 million people were known to have the disease. And the dramatic increase to that in 1995 was 100 to 135 million, is why I believe this disease is very important to be researched on more, because it's becoming such a big issue around the world as the rates have increased so rapidly. The 5 countries in 2000 that had the most people with diabetes were India, China, the US, Indonesia, and Japan. The World Health Organization considers this a global health epidemic, and because of this, many different countries are doing research and trying to find ways to cure this disease and find medicines to help with its effects on those who have it. The main diagnostic test done to find if people have type 2 diabetes is called the glycated hemoglobin test, also known as the A1C test. And this measures blood sugar levels over the past 2 to 3 months. It measures how much blood sugar is attached to the hemoglobin, and a rate of 6.5% or higher tells that you have type 2 diabetes. Other tests are done for people who have certain conditions that could alter the results of the glycated hemoglobin test. These are random blood sugar tests, fasting blood sugar tests, and one that is specific to type 2 diabetes is the oral glucose test, which is where you fast overnight and then your blood sugar level is measured, and then they also give you a sugary drink, and then they measure your blood sugar level over the next 2 hours. And a blood sugar level over 200 is indicating that you have type 2 diabetes. Urine tests are also done to do this, but they're not as common, as they can have misread results due to them. They measure other things besides just what would suggest having type 2 diabetes, like other sugars and things that could make the results inaccurate. Treatment and prevention done for this is obviously the most well-known one is insulin. There's a pen, a pump, and a syringe that can be used to do this, and there's 4 types. There's rapid acting, which is effective within about 5 minutes, but its effects only last for about 2 to 4 hours. And then it goes all the way to long acting, which gets in the bloodstream in about 10 hours and is effective for 20 to 24 hours after that. There's also oral medicine, which is specific to type 2 diabetes, which helps regulate blood glucose level or blood sugar. There's also medicine for these patients who have associated conditions like high blood pressure and high cholesterol. And also a specialized diet or exercise plan is important in the treatment of this disease, as obesity and poor health is a very big cause for the disease. Prevention is just losing weight by eating healthy and exercising, and also quitting smoking can help with like associated conditions that can lead to the disease, like high blood pressure and things like that. And it's also just important for keeping your overall health well. And also just monitoring your health numbers, like the blood pressure and the blood sugar, is important so you know what's going on with your body, because it's always important for that. In conclusion, this disease, this disorder, diabetes, is a very big problem. It's a worldwide epidemic. And as type 2 diabetes accounts for about 90% of the cases of all diabetes in the world, I think that's the most important one to try to find a cure for and to try to help lessen its effects on those who have it. Although I may be a little biased due to my grandfather having the disease for why I think it's more important. But there have recently been some studies to show that people have been able to reverse the effects and reduce the effects of this disease in particular, since there is only a lack of insulin and not just a complete like absence of it. So by eating healthy and exercising, they're able to live a more longer and healthy life. So that's why I believe this disease is relevant to today, and why I believe it's important to know about. Thank you.